Night Health continues. I'm Mark Alyn. Join us at latenighthealth.com, latenighthealth.com. Let me give you some statistics. Hicksney recently did a public opinion poll of 1,000 residents, and here's some of the results. 85% of those respondents expect their healthcare providers to share their health records. Nearly the same number of adults expected their providers to use an electronic health information exchange. And last, what we're going to start with, what's the message that the consumers of the general public, Mark, are asking about their healthcare records?
So, clearly what patients are saying is that the conversation is shifting to where the patients want to take a much more active role in their own healthcare, and having the ability to have access to their data and have the ability to understand it and to use that in a meaningful way is clear.
The study, why did you guys decide to do the study? You must have known this. Did you know the results before you did the study? Or did you surmise? Did you surmise? Let's put it that way.
We had, we did kind of expect that the results that we got would come out the way that they did to some degree, but there were clearly some surprises for us as we went through this. But the reason why we did this study is so that we could really understand where, the patients really stood on issues related to health information exchange right now. Ultimately, there's a lot of news about information security out there in general, with not even healthcare related these days in terms of privacy, and and the ability for patients to understand how all of that comes together, and whether this information they wanted to have that information electronically available, and what kind of concerns they had about it were the reasons why we did this.
And I can understand not sharing my Amex account or my bank account, but do I really care if somebody knows that I had measles when I was 8 years old?
You may not care as much about your health history for some people, but there are other people who are very concerned about it. But certainly there's very specific law around certain types of treatments and information. Patients often have, some patients have much more sensitive conditions than others. Patients with AIDS or substance abuse treatment or mental health conditions often want to see that information more secured and safeguarded than somebody who maybe just had a prescription for penicillin.
That makes sense. If somebody is... Actually, years ago, I can remember a doctor calling and giving my wife information about some testing that I had, and I was concerned. I was actually a little bit upset because of that the doctor gave her the information before me. I mean, there wasn't anything really wrong in her knowing. I would have shared with her anyway. But now I don't even think wives or spouses or husbands can get that information. Generally speaking,
that under the HIPAA, that information is to be shared with the patient. And the patient can designate surrogates or proxies or other people who can have access to that information. But the reality is that, with a lot of the growth in electronic information, and obviously easy to copy and share the information, but we need to make sure that patients' rights around privacy are clearly protected. And so, there's been obviously a big transition over a long period of time to make that happen.
Will medical records sharing in these HIEs, will that help lower medical costs and insurance costs, in your opinion? Or can it?
I think that it does. I think it does help. We know that, when we started this study, one of the things that we did is we first looked to perform a literature review to really find out what information was out there And what we found is there was very little information that really had been documented in the literature around how electronic information was impacting cost and quality.
Mark, we're out of time.
The survey.
Gotcha. Mark, we appreciate your time. If you want information on Hixney, we'll have a website at latenighthealth.com. Mark McKinney has been our guest. We appreciate that. And we appreciate you for joining us here on Late Night Health. Thank you very much. We'll see you next time. Have a good week, and most importantly, have a healthy week. Bye-bye for now.
If you're listening to Late Night Health right now, you're part of the growing target of baby boomers we're serving. Hi, I'm Daryl Wayne, producer of Late Night Health, inviting you to join the Late Night Health family. If you have any business targeting the growing boomer market, Late Night Health is the ideal advertising vehicle for you. From vitamins to insurance, alternative health to Western-style medicine, Late Night Health caters to the growing population of those over 40 years old. This vibrant demographic has expendable income to fight aging, purchase travel, take care of aging parents, or just have fun. Find out about the advertising opportunities with Late Night Health. Call us at 805-391-0308. That's 805-391-0308, or email us at info@latenighthealth.com. That's info@latenighthealth.com. Join Late Night Health as we empower people to take charge of their own health care. Call now at 805-391-0308. That's 805-391-0308.